Hey everyone, and welcome to the live stream. Today we're going to be answering questions about medical coding careers, including things like exams and certifications and CEUs and studying tips and job seeking, and even more than that. So grab yourself a drink, say hi to your friends in the chat, and let's get started with today's stream. I love that theme song. So, hey, everyone, if you're new here, I'm Victoria Moll. I'm a medical coder, author, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. And every Saturday at 2 o'clock, usually, I'm here for our live stream. That might be changing in October. I've got just about every single Saturday in October booked. We might have to switch it up for Saturday. Hello to Mallory. Hey, Marissa, good to see you here. Did you all see, if you guys remember Marissa, we did an interview with Marissa. Oh gosh, it's probably been a year now, right? And Marissa is doing some great stuff these days. She was just on a lot of different stuff on social media for AAPC featuring her. So lots of congratulations to Marissa and Isabel and Crystal. Hello. Hey, you guys. So a couple of things have been changing around here. First off, I don't know if you noticed, over in this little corner over here, there's an extra light that I added into the little cubie. Very, very cute. And hey, Seno Jose is here. Hello, Seno. This is going to be possibly the last time you guys will see me with this exact setup. I've been posting a couple things on my Instagram, but this is so I've been using a gaming PC for a while, but it's a little bit, it's good for what I've done in the past 2 years, but I need something with a stronger capacity for live streaming, for video editing. So I finally agreed to let my boyfriend build me basically a streaming PC, and the parts are just about here. I had to get special graphics cards, and I got a hard drive and all kinds of stuff to put in it. So I think by next week we should be set up, and it'll be nicer with the different document camera, so I can show you stuff and books and things with the setup for the live stream. So I'm really, really excited about that. I've already seen some questions coming in, but hey, let me know in the chat, what right now is your biggest hurdle? So are you someone who's just interested in medical coding? You're having trouble finding the right school? Are you getting ready now for your certification? Are you deciding what certification you want to get for a first or a second or a third certification? Are you struggling with finding the right job, getting your CEUs, moving into a next new specialty? What is it that I can help you guys out with today? Give you some of my tips and tricks. Hello, it's got lots of friends in here from India. Great to see you guys on the chat today. Let's see. Now I know I saw some questions coming in a little bit earlier, so I'm going to start with this one. What is dental coding, certification, etc., etc.? Please tell. So dental coding is a little bit different from medical coding. You can just take dental coding on its own, because a lot of the dental codes come in their own code sets. Now, there might be some crossover from some of the oral surgery type stuff that you might find in CPT. I haven't specifically done dental coding, but my community college has recently started offering a course just in dental coding. So it's just a few weeks long. So you might be able to find even online some offerings. I know the AAPC has something. Let me check over here. They do have, it's not a certification like a CPC or a CPB, but they do offer training specifically in dental coding. Let's take a look here. I believe it's maybe under education and then dental coding. Let's take a look. Here it is. Yes. So if you go to the AAPC website here under advanced courses, there is a training that they do offer for dental coding. So you don't have to go through the entirety that you might have for medical coding, where you're learning medical terminology and anatomy and physiology, because it's a very directed specialty. So you can purchase just the dental billing and coding course with the AAPC. Let's see. I'm not even sure how much it is right now. Let's see how much it says when we hit enroll. $399. So that's not even too bad. Now, it does say you have to have an AAPC membership. Oh, maybe you don't. Why become a member? Oh, it costs more maybe. if you're not a member. You can save $50 if you're an AAPC member. So again, there's no current certification, at least through the AAPC for dental coding. There might be through different organizations, but that is something that if you just want to work in a dental office, you can look at that. There are different code books that you will need. So the CDT, which is the dental terminology book. So that is that's a different type of coding. I've not done it myself. Interested in learning at some point, not certainly at the top of my priority list right now, but if you're into that kind of thing, definitely something to look into. I'm seeing some congratulations here in the chat. Who did I miss? Who passed their exam? Da, 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 da. I missed someone. Crystal. Hey. Crystal Moreno. Passed my CPC exam, so I thought that I should start looking for a job, but I started on practicode and purchased Codify, and it seemed to be very lost. So yeah, the practicode is tough. It's tough because now you're transitioning from a studying where you can pick 1 out of 4 to having to just pick the codes all by yourself. And if you need help with getting through at least how to input your information into practicode, I do have a video on that. So if you or anyone else needs to kind of just see a little bit of how to navigate through practicode, you can check that video out. It's on the main channel page. What you can do is if you go to, let's see, I don't want to start playing anything because of copyrights. And I don't like to get copyright strikes on my channel. But if you go to the main channel page here, let's see. What you can do is there's a little search magnifying glass here, and you can type in practicode, and it'll bring up the video that I kind of talk about practicode, what it is, because even if you're coding through practicode, and let's say you're coding a surgery, it doesn't tell you if it should be 2 codes, 3 codes, 4 CPTs, 5 ICD-10s. They just give you blanks and you have to fill it in. So you can kind of see a little bit of a tidbit of what that format looks like, and how to get to maybe some of the resources that are in there. It is kind of tough. I know there was someone else in here, I think. Hey, Amber, congratulations on your first coding job. That is great. That's fantastic. That is a really good starting wage, too, for a starting coding job. I'm sure everyone in the chat's probably asking you if where you're going and if they're still hiring. Let's see here. Mallory's asking, since you're an instructor through the AAPC, is there a significant difference between your CPMA course and the course the AAPC offers? So what the AAPC does is they have all the materials that they've put together for their different certifications for the CPC, for the CPB, CRC, CPMA, etc. And as an AAPC instructor, what that does is that allows you to license all of that material for them that they've already put together, all of the slides, the PowerPoints, the exam banks, practice materials, worksheets, etc., and I pay them a licensing fee for that information. So I take all of the stuff that the AAPC has, all their stuff based off of the actual curriculum. I get to buy study guides for a cheaper price for my students and stuff. And I take all that licensed material, I add extra stuff into it, I change up some graphics that might be outdated. I add in demonstrations. So one of the things that I love about my CPMA course is when they're talking about things like the Federal Register, I'll actually go and do kind of like I do here. I'll show you like, oh, here's how you go through the Federal Register and walk you through it. Versus the AAPC course. So it's not exactly the same as the AAPC course because it's really like me actively teaching you and showing you the different websites and references and walking you through things like how to find E&M references. I give you toolkits, so like information of web links that you need to know. I also have flashcards available through my CPMA course. I'm going to start working on them, I think, for the CRC as well. And they're for Quizlet. So you have to be a student of my course in order to get access to the CPMA Quizlets, which have a lot of those terms that you need to practice and know for the CPMA exam. So it's the same. It's based off of the same material that the AAPC has. It is not exactly the same because, again, it's me and I'm boop, 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 teaching you through the course. And then I have all kinds of extra stuff and then, clarify a lot of information more robustly than you might find on the course that's on the AAPC website. And you get me as an instructor, which if you buy directly from the AAPC, you can't get me as an instructor. So is the AAPC CPC exam exactly the same as a HIMA CPC exam? So there's two different exams for professional fee coding. So if you want to get certified in professional fee or provider-based services, you can get the CPC with AAPC or the CCSP with a HIMA. And those are two different governing certification organizations. The exams are not the same. So we can kind of take a look at that actually right now here. Let me get back to the AAPC website and then I can show you. I know off the top of my head the AAPC regulations. I'm not 100% sure about the HIMA certifications. So if we go to the AAPC website, certification for the CPC, the exam breakdown, 5 hours, 40 minutes, 150 questions. You can take it online or you can take it in person. There are some slight differences for that, but they're going to test you on 10,000, 20, 30, 40, 50, 60, E&M, anesthesia, radiology, lab path, all things in the CPT book. They're going to ask you 10 ICD-10 specific questions, HCPCS, coding guidelines, compliance, and regulatory. They have listings of their approved manuals here. Certification requirements, which are all more so recommendations than they are hard and fast requirements. And then if we go, let's see, over here to the HIMA website, this would be the equivalent of that for a HIMA is the CCSP. So let's see what it says. Eligibility requirements, complete courses in the following topics: anatomy and physiology, med term reimbursement methodology, intermediate or advanced diagnostic coding and procedural coding, plus 1 year of coding experience. So if you don't meet the eligibility requirements for the CCSP, you can possibly get the CCA, which would be their certified coding associate. So that would be, those are the two professional fee coding certifications, the CPC and the CCSP. I'm not sure if it says on here exactly how many questions there are, but it does give you the outline. Let's see here, diagnosis coding, procedure coding. And from what I understand, because I've not taken any HIMA certifications myself, but I think there are some questions that are not multiple choice versus the AAPC exam, which is all multiple choice questions. But you can, that's all available on the HIMA website as well as the AAPC website. So you can kind of compare and contrast those. Melissa, that is a great question that Melissa is asking. Melissa is asking, which company do you recommend for E&O insurance? So there's two tips I can give as far as this goes. One is, I think as an AAPC member, they do have, and maybe I have to log in here quick and do membership benefits. Hold on one second. Because there is a discount that you're supposed to get from the AAPC website, but when I contacted them, I did not have a good response. The prior company they used to use was great, but if you go to your AAPC membership benefits page, which is under that membership tab there, membership and then membership benefits, they do typically have a place on here that you can get savings for, let's see if it's under here, exclusive member only savings center. It might be here, code books, insurance. Here you go. So they do have an offering through the AAPC for the E&O, errors and omissions or liability insurance. I go through HISCOX, HISCOX, and they can get you hooked up in like no time. You basically fill out a form. I think it is a little bit more expensive for some of them. I did have a more budget-friendly resource I used to use, but then when I went to renew, they were like, oh, well, we only do healthcare providers for liability insurance and not coders. And I'm like, I literally had a policy with you before. But that's the website I use now, and I'll bring it up here so I can kind of show you. But you can get E&O through HISCOX really easily, and it takes absolutely no time. You can pay it right online. Right there's their professional liability insurance. So that's who I go through, and they've made it super, super easy to get liability insurance for a medical coder. For those of you that aren't aware what liability insurance is, honestly, not a lot of coders have it. When I worked with when I first got liability insurance, errors and omissions insurance, I was working for a large healthcare organization and I was buying part-time insurance because I was doing speaking engagements and some part-time independent work. And I wanted to be protected in case I would, in the event of maybe doing some consulting work or something, we'll say, and I did something wrong and they came back and the organization that I was working with tried to sue me and say that we're going to try and recoup the money because you did this incorrectly, inadvertently. That insurance would protect me in the event of that kind of lawsuit. The organization that I was working for full-time, the healthcare hospital, whatever you want to call it, they said to me that there was some sort of insurance that I had as a coder through the organization somewhere. So the organization you may be working for, if you're working for a healthcare organization, a hospital, a health network, a billing office, they might have you insured that way. If you're working as a contractor and you're independent, you definitely want to get errors and omissions insurance for that circumstance. I think it's better to have it than to not, but it is an extra expense. It's one of those things that sometimes people don't think about. I remember I always reflect back on the first time I moved out of my house and rented an apartment. And I asked one of my coworkers that I knew also rented, I said, hey, who do you go through for renter's insurance? And she's like, well, why do I have to insure everything? Because if the house lights on fire, it's going to be the landlord's responsibility. And I'm like, well, no, the stuff that's owned by you inside your house, you have to insure. That's not the landlord's responsibilities. If you lose your bed and your furniture and all of your belongings, you have to insure that as a renter. So one of those things sometimes we don't think about as coders, but not bad idea to have it. And certainly if you're working independently, doing any contracting work or independent work, you really should look into getting errors and omissions or liability insurance. I keep seeing this question pop up. Can you please make a video on inpatient DRG coding? I do not know inpatient DRG coding. If you're looking for inpatient DRG coding, trying to think who you might be able to go through right now that actually teaches inpatient DRG on YouTube. Maybe Dr. Campbell. I would check maybe Dr. Campbell's Coding and CDI Corner. She might have some stuff because I think she might do inpatient coding, but I can't teach you that because I do not know inpatient DRG coding at this time. So it would not be able to provide any videos specifically to that. Diana is asking, what kind of coding can you make the most money in inpatient hospital, surgery, cardiovascular? So the two biggest ones that I know of are inpatient coding usually pays more than professional fee. We're seeing an increase in risk adjustment. Auditing, definitely you can make more money in auditing, but I would say generally inpatient DRG and DRG validation definitely is a high paying one. Maybe not the best for starters. And also interventional radiology is a big high paying one, but again, not the one that you can probably do right out of the gate, but work up to after, a year or two of understanding the generalities of medical coding. Not saying that you can't specialize in that right away, but it would be harder, I think, to specialize in that right out of the gate. Kay is saying, I passed my CPC CRC. Congratulations to you. That's awesome, awesome, awesome. Completed an 80-hour course, which takes a year off your apprentice status, and you're working on your practicode. Good, good, good. So for those of you who are kind of new, when you pass your CPC, there's two AAPC certifications that you have apprentice status with, the CPC and the COC. Those are the only two that have an apprentice designation. So in order to remove that apprentice, you have to have 2 years experience, or you can remove 1 year by doing 80 contact hours of an appropriate course approved through the AAPC, or you can have a year taken off as well doing practicode. So that's what Kay's working on right now, her practicode. I have a MacBook. Should I look into an in-house job and delay buying a computer equipment or go ahead and spend the money? I would wait, because depending on where you work, they might send you a laptop. There are a lot of organizations out there that do send out their equipment. So I would hate for you to spend, $800, $900 on a laptop or a PC and a monitor and then find out that they're going to ship you something anyway, unless you're planning on using it for additional work. So I used to have, and I think I talked about this at the last stream, a KVM switch. So I have my laptop over here, and then I had a work laptop kind of underneath my desk, and I could hit a button on the KVM switch and it would transfer everything over for my keyboard, video, and mouse. So I wouldn't have to have two keyboards and two different monitors and two different mice hooked up, because I could just switch in between those with that KVM switch. Amber is asking about the CRC credential, and can you explain risk adjustment coding? Sure. So risk adjustment coding is just ICD-10-CM. So with risk adjustment, you only got one book. So if you're going for your CRC, you're going to take this book, only this book. If you want to take printed guidelines for ICD-10-CM, you can take those too. But you're just working with ICD-10-CM. You don't have to worry about CPT. You don't have to worry about HICPICS. You don't have to worry about ICD-10 PCS. You can just work on ICD-10-CM. So what happens is, I just heard my new member thing go off but not show. Let me check and double. Is my alert box on? It is. I don't know what the heck's going on there. Where's my dancing SpongeBob? So with risk adjustment coding, there's a lot of incentives now on quality of care, as well as identifying these patients that have these risky, expensive diagnoses, and making sure that we're diverting funds to the patients that have more complicated conditions, cancer and HIV, heart diseases, and making sure that we have enough funds, we've budgeted enough funds through that. So Medicare pays different Medicare Advantage plans extra money for all the patients that they have enrolled with all of these really complicated diagnoses, because we know they're going to cost more to take care of. So in risk adjustment, it's really identifying those specific diagnoses that risk adjust, those diagnoses that we know are going to cost us more. So we have like tens of thousands of ICD-10-CM codes, but there's 9,500 or so that have this HCC, this hierarchical condition category. They risk adjust. So that certification specializes in just knowing a lot of ICD-10-CM information, knowing about the different programs that pay extra for these complicated patients, what these specific diagnosis codes are, the factors of each of these diagnosis codes, because some of them are more severe than others. So they each have a different factor to them based off of, they're kind of weighted. So ones that are more severe have a higher weight versus ones that are less severe have a lower weight, and just really targeting in on those complicated diagnoses that do risk adjust and taking care of those. So for the risk adjustment, the CRC exam, they test you on not just ICD-10-CM coding. So you can't just go in there and be like, oh, I know ICD-10-CM, this is going to be a piece of cake, because there's a lot more that they test you on, and they test you really in depth in ICD-10-CM coding. So if you go to the AAPC website and kind of look at the CRC exam, what is in the exam is not just ICD-10-CM, but also compliance. So things on prospective audits, RADV audits, which are the risk adjustment data validation audits. Again, just ICD-10-CM. Diagnosis coding is a huge part of it. And these are some of these diagnoses that risk adjust: amputations, artificial openings, congestive heart failure. So this is going to be the bulk of the diagnosis questions that they're going to ask you, because these are the ones that risk adjust. They're going to ask you 18 questions on documentation improvement. Pathophysiology, med-term, and anatomy are just going to be 8 questions. And then they have the purpose and use of risk adjustment models. So data mining, applying different risk adjustment hierarchies. Quality care is going to be a part. So they're going to test you on HEDIS and STAR ratings, as well as the different types of risk adjustment models, ones for Medicare or Medicare Advantage, the CDPS, and the ACA as well. So it's a great certification. There's a lot more organizations now that hire risk adjustment coders specifically to look at their provider diagnoses, because now they're getting incentives in their contracts that they're saying, hey, if you take all these patients that have, congestive heart failure and atrial fibrillation and heart disease and cancer, and you take really good care of them, we'll give you these extra bonus payments. The organizations don't want to lose out on those bonus payments. So now they're forming departments of risk adjustment coders just to look at diagnosis coding, which we didn't see too much in the past. There's been a lot of risk adjustment jobs in the past have just been on the insurance side of things, but now we're starting to see more provider and hospital healthcare organization based risk adjustment coders full time.
Increase your uploads. By the way, if you go live and you cut out some clips.
Sean Cannell just started blasting on my phone there for a second. I don't know what the heck that was about. Let's see, what else? What specialty do I work with often? Evaluation and management coding, surgical coding, and specifically plastic surgery has been my forte in the past. So anything related to the skin, anything related to breast reconstruction, tummy tucks, cleft lip and palate repairs, eye lifts, all that plastic surgery stuff I do. Pay for risk adjustment coding. So I really should put my risk adjustment presentation updated and back together, but there is some information you can find. Let's see if I have it on my website here, because I know I have FAQs. I know the last, I think it was the salary survey before last, it was quite a bit more. I'm not sure if I have it, but you can check the AAPC salary survey if you just go into Google and type in AAPC salary survey. It'll bring up the information with all of the different information. Actually, let's just go ahead and do it now. AAPC salary survey, and it can bring you up the averages based off of the surveys that they've done of their members, of what the salaries are based off of certification, based off of area. Let's see what we got over here. So job responsibility, inpatient productivity standards, Profi coding, expertise. Okay, so this one will have to, can I zoom in from here? My goodness. So it looks like CRC. Let me see if I can zoom in here so we can look at this picture a little bit easier. Whoop. No. So this is the salary survey. I'm so tiny, I have to like zoom in myself to look. So it looks like the CRC is usually 62,000 around. Yeah, that's the 2020. So 62,000 and change. CPC is almost 56,000. So it looks like based off of the 2020, the CRC is actually more than just the CPC. And then CPMAs a little bit higher than that as well. So yeah, they do membership surveys every year, the AAPC, and they take all that feedback to put in a salary survey of all the information of what the salaries are based off of years of experience, based off of region. Hey, Brian Simpson, thank you so much for your $90.99 super chat. I really greatly appreciate that. Brian Simpson in the house, you guys. Always love to see Brian in here. He's so supportive of just everyone and everything, and just like Brian's a sponge. He just soaks up all the education he can. Thank you so much, Brian. Faraz, that's a great question. Can I explain the difference on modifier 58, 78, and 79? Can I please create a video on that? Yeah, I can definitely do some more modifier videos, and I'm not sure if I cover them specifically on this webinar that I have, but I do have a modifier webinar on my website. So if any of you are interested in getting some information on modifiers, I do have one. I don't think it talks specifically about those ones because they are a little bit more surgical, but I do have a modifier course that you can take for free. There's a little preview here, all 100% free on demand, and there's an AAPC CEU approved for it. So if you have an AAPC certification and you take this, you can get one AAPC CEU. So I have modifiers for the medical office. That's free on demand CEU. And I just have a new one that I added just the other week, Secrets of Successful Auditors, also on demand. And that offers one AAPC CEU. I'll have another one coming up soon. What's the next one I want to do? ICD-10-CM updates. That's a great one. I'm very excited about the ICD-10-CM updates. So yeah, it looks like, yeah, Elizabeth is asking too about some modifiers or additional resources explaining modifiers. So one thing I can tell you, I think some of the Medicare contractors have modifier webinars from time to time. the one thing that I have always found helpful is if you go into your CPT book. So we all know that on our inside flap, we have our modifiers listed here, right? But that's just the short descriptions of the modifiers, our abbreviated descriptions of the modifiers. If you go into your Appendix A of your CPT book, all the way here in the back, that's where you will find the full descriptions of your modifiers. So if you flip all the way back here, these are where all of the more robust descriptions of your modifiers are. So if you're not sure about a modifier 58, for example, there is a full description that you can find for it here, and that it's a stage-related procedure. I used to do 58s a lot when I worked in plastic surgery because we would have patients that would come in for breast augmentation. So they would have a full mastectomy and they would put in a tissue expander. So they would fill the tissue expander up with saline until there was enough tissue space there so that they could get a permanent implant. And so when they came in then to replace that tissue expander with the permanent implant, we would use the modifier 58 because it was staged, it was planned. We knew that when we put that tissue expander in, that at some point they were going to come back in and get those permanent replacements. So that would be a stage related versus a 78, where if you look at the definition of 78, it is an unplanned. So this is something where they're returning to the operating room and we didn't have this planned. It's not like we had this set that we were doing, you know, like a tissue expander insertion, and then we were going to replace it with something permanent. So that's an unplanned return to the operating room. 79, if you look here, is the unrelated. So this was something that was totally unrelated. So maybe the patient came in, they had their right wrist fracture repaired, and now they fractured their left wrist. So that would be totally unrelated. But this is something that's unplanned, but it's related to the original procedure. But yeah, I can definitely do some more modifier stuff. Those are easy ones to do. How you started your YouTube channel and how you prepared for your first video. That's a great question. So let's see, let me think. When did I start my YouTube? It's been a little over a year now. Currently at over 30,000 subscribers. I gain a little over 100 subscribers a day now. It's pretty crazy. And I started my YouTube channel. So I actually did a YouTube channel, a YouTube video a few years ago. I think it's deleted. It was on a different account now because I've tried to find it. I found it once and then it just was gone. How did I prepare for my first video? So I think at that time I was drafting things in paper books. So I had and I still like doodling things on paper. So this one is actually just notes to myself that I've just been doodling on a big sketch pad. But I had a notebook and I just kind of wrote down what it was I wanted to say. I usually do bullet points when I make my videos. So I'm like, I'm going to go over this, 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 and this. And then I kind of talk generally about that bullet point. I don't script everything out unless I'm doing something maybe like an affiliate promotion, because I have had some videos where I have paid promotions and then they're notated on YouTube. If you're interested actually in learning about YouTube, the best tips I can give you is I really, really like the book, The YouTube Formula by Daryl Eves. He works with Mr. Beast. I used to follow a lot of stuff with Think Media and Sean Cannell, but I got a little bit turned off on their last conference. Won't get too far into that. It's way down the rabbit hole. But that's the best book I recommend is if you're interested in YouTube, get The YouTube Formula by Daryl Eves. That's a phenomenal book and really explains about all the different format and the algorithms and things that go into it, thumbnail concepts and everything. I'm taking a medical administrative assistant class with EHR. I'm thinking this would be a foot in the door to an office and then the ability to gain coding experience. What are your thoughts? I think so. Anything you can do to get into healthcare is definitely going to help you out. I think one of the frustrating things we deal with as medical coders is we get our medical coding certification. We immediately want a coding job. I mean, that makes sense, right? We would immediately want a coding job. But sometimes if we can't get that coding job, we have to take something that might get that foot in the door, maybe work with codes a little bit, or at least work with the EHR a little bit. And I think that would be a good way to start getting familiar. If you're really wanting a career in healthcare, you can get familiar with working with the electronic health records. And I think it's good to have a strong background in how the EHRs work. You know, that's a great way to gain that experience, to start getting familiar with how the documentation gets in, how that documentation sometimes transmits into a code, how providers are maybe placing orders, you know, what that even looks like on the back end. I think it's absolutely fantastic. Paula Neary, great to see you here, Paula. Do I have Paula's crown? I moved it. I moved it. I put it on right now. No, wait, hold on. I'm putting the crown that Paula gave me on in honor of Paula being here right now and asking this question and me answering it. Looking for an in-person CPC exam in California. There aren't many where I live. California is a tough area right now. Do you think they will add a few closer to the end of the year? So this is what happens with the medical coding exams. And this is why it's sometimes hard to find them, especially at the end of the year. So the AAPC and the HIMA have two different thought processes with exams. So HIMA, they have testing centers. You go to that testing center, there's people there taking a HIMA exams, there's people there taking all kinds of other different certifications through other organizations. The AAPC has relied on their local chapters to administer the exams. Traditionally, the local chapters have a hospital or healthcare organization or a school that they can borrow space from for free, because usually someone works there, and they can administer the exams there, just borrow that space. Because of the things going on with the pandemic, some of those organizations are becoming a little bit more strict, or not allowing them to borrow that space. My healthcare organization that I used to go through to administer exams for my local chapter, they basically stated to us recently, they're like, yeah, you can use our space for an exam, but everyone has to wear a mask the entire time, and there will be no food or beverage for the entire 5 hours and 40 minutes of the exam. So that wasn't even an option, to not let people drink for 5 hours and 40 minutes. So there's still just a lot of struggle, I think, right now finding space. So it would be the responsibility of the local chapters in California to find those exams and get volunteers to proctor those exams. Will that possibly change in the future? It could. Is there also the possibility, and I don't know how many people have done this successfully in the past, but it is possible that if you can't take it online because of situations in your personal home, it is entirely possible to just maybe rent a hotel room with really good Wi-Fi and see if maybe you could set something up there. You know, that is an option. But, you know, you could potentially also have to travel. I had to travel not terribly far, a couple of hours out to Hershey, Pennsylvania to take my CPC exam back in 2008, I think it was, because I didn't have local chapters nearby. So those are the options that you have. So they might open more, but it really depends on if the local chapters can find space and do have people that are willing to go out and proctor the examination. I'm going to take my crown off now. I know I should do a mermaid video. I've don't give me any more ideas, because I've been having trouble focusing as it is. I've just got so many things that are just popping in my mind, and I'm like, oh yeah, I could do that. Oh yeah, I could do that. Oh yeah, I could do that. And then I have trouble focusing. Lily Anna is asking, how would you suggest someone to self-study? What are some of the books you recommend? So I do have a video on that as well. I wouldn't highly recommend to everyone to self-study. I think there are certain people that can be very successful in it. Kind of up to you and knowing your boundaries and what your learning style is to determine if that's a good fit for you. So if you feel that you're a good self-studier and that this is something that you'd be interested in learning on your own, I do have a video where I give different tips on that. So let's see here in the channel. Self-study. Now, the video that I have on here in self-study options does also have the book recommendations listed in the description of the video here. So if you go here, show more, I have the different books listed. The ones that I recommend for your textbook and your workbook are the step-by-step books. Those are absolutely top notch. Those are the best instructional books you will find in medical coding. The caveat, though, is that the step-by-step books only provide the answers to the odd questions. So you will not have half of the answers for the practice questions and case studies and stuff that they have within the workbooks. It depends on what you want, because some people have said that's a big barrier for them, but honestly, you will not find a textbook that is as good as the step-by-step medical coding books. The only other option you would have is if you just want to do CPC study, you could maybe also go on the AAPC website. Now my monitor is zoomed in. Let's get this back down to the regular size. You could also maybe go on the AAPC website and just go to the study guide materials and purchase, if you're just getting like a particular credential like the CPC, you could go and get the study guide. Let's see here. My AAPC book software reference guide, certification study guides. So if you were looking to get your CPC certification, you could go on here and just get the study guide. I don't think it will be quite as robust as the step-by-step books. Can you list the step-by-step books or the ones for the CPC, like operative reports? The step-by-step books are available. I know they have them on Amazon, or the ones for CPC, like operative reports. As far as like books for operative reports, I'm not aware of any books that you could get currently just for operative reports. I know they do have some focused practicodes that you can do for operative reports, but yeah, I'm definitely looking into doing some more case study view videos. I actually wrote a note to myself today to try and do some more short form videos for those as well. Some short form case studies and long-term case studies. I actually have a folder of some stuff that I've been putting together. And also, just one trick I've learned recently is if I find any, I can basically go into Codify, look up any CPT code and look at what the lay term is for it that describes it, and kind of from there develop a case study in some cases. Who does, for the step-by-step books? But let me see if I can find them on Amazon. Step-by-step medical coding. Yes, those are the ones by Carol Bucks. So they are over here. So that's the workbook and then the textbook. I think they do have one. Yeah, that's a package. That's the textbook and the workbook. But again, all the even ones, they don't have the answers for. But as far as learning medical coding, those are great. The other thing that I would highly recommend, I don't know that I have this here either. Here we go. If you don't know MedTerm and Anatomy, this is the book that I recommend for learning MedTerm and Anatomy. It is Medical Terminology and Anatomy for Coding. There is a 4th edition now, so you can find that. I think I usually have it linked in my video description. If I don't, there's a video that I have called How to Learn Medical Terminology as a Medical Coder. So you can check that one out too. So if you need MedTerm and Anatomy, this book is great, because as you're learning MedTerm and as you're learning Anatomy, it pulls out certain sections of CPT and ICD-10 and says, hey, this is how this kind of applies to coding. So this is like the best book recommended to everyone for MedTerm and Anatomy if you're looking to learn that as a coder. Do I know of a good place to find a review of the payment methodologies for the COC exam? The study guide for the COC exam I found super helpful. And I know cco.us has their Blitz program. And if I remember correctly, they do cover that in there. So check on cco.us because I like their Blitz programs because they're kind of more than just a review, but not as much as a full course. They're kind of that in the middle. And I think they have some stuff for the COC Blitz. Da, 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 da. Diana is asking, I thought about purchasing AAPC Codified. Do I recommend basic, profi, or complete? What one do I have? I think I have the profi version, but let me double check. My AAPC Codified. So Codify is the AAPC's encoder program. And let me see if it says on here which one I have. I don't know that it does. Codify by AAPC, my Codify. I think I have the Profi if I remember correctly. Let me just do one thing because I don't want to accidentally click on something and it pops up my home address. Codify. I think I have the Profi because I think if I remember correctly, the basic just lets you look up codes and descriptions, but the one I have allows you to look up CCI edits and stuff too. Now let's see. It says advanced code search, basic, profi, and complete coder. Let's see. So profi includes advanced code search, CMS references, modifier power packs, CCI edit checker, LCD lookup, RVU calculators, and the lay terms. Yes, I would go with the profi. I'm pretty sure that's the version that I have is the profi. How much is the book, the Med-Term and Anatomy for Coding? I think the one I have is like $10 cheaper than the new version. Medical terminology for coding. It is on Amazon, $85. So not too bad. I love this book. Seriously love it. Marissa, where can I get a refresher class for billing and coding in New York City? I took the course back in 2008. A couple options. So if you're looking for something in person, check with your local chapter. Sometimes they do have stuff. I don't know if they're doing it in person. You could check also maybe with your local business schools or community colleges. But I know a good way to refresh would be with your local chapters and to see if they're having any review classes. If you're interested, I also have an on-demand review class. It's not in person. It's just like on demand at your own pace, and that's under my CPC review. So if you're looking to just refresh on coding, you want to learn some ICD-10-CM, you can take that. I also have a course that's just on ICD-10-CM because back in 2008, yeah, you were definitely trained on ICD-9, so you would need to learn ICD-10 coding. So I do have a course on that as well. It's very, very affordable, highly rated, 5 stars. But yeah, you can also check with your local community colleges, technical schools, or your AAPC chapter. You can find your local chapter online by going to the AAPC website. Let me show you real quick on here. Networking. So if you go to networking, find a chapter, you can go through here. And if you're looking for one in New York, you can check all the different chapters in New York State. And some of them might have some different offerings that might be of interest to you, like review classes and stuff. So you can check on all of these and see what stuff they have coming up. So let's see here. Buffalo, we'll see. What have we got going on in the Buffalo chapter? They have some exams. They have an E&M meeting coming up, virtual meeting. Doesn't look like any review classes, but you can check those for all of their upcoming stuff. Mary Cassidy, thank you so, so much for the super chat or super sticker. Did it come in as super chat or super sticker? I missed it. Oh, there it goes. Thank you, Mary Cassidy, for the $4.99 super chat. Greatly, greatly, greatly appreciate that. So Mary Cassidy is asking, hey, Victoria, I was thinking about going through the course that HIMA offers for the CCS certification. Is this a good certification to have? And also, is HIMA's course good? I've not taken any of HIMA's courses, but I can tell you that when I tell people who want to get into medical coding, I say always get something through AAPC or HIMA. AAPC and HIMA are our Coke and Pepsi. They are our two major brands. Those are the ones that everyone's going to want. They're going to want you to have a certification through AAPC or HIMA. So I actually wasn't even aware that AAP or HIMA did specific courses for their certification, but I'm sure since they're the one administering the CCS, they would have to have a very good course on it, right? Because they know exactly what's going to be on it. So I would think that would be a good option for you. Just make sure that if you're doing that, that you're meeting all of their requirements. They're on their website and that you have all the materials and stuff that you need as far as books for the exam. Yeah, so when you become an AAPC member, what they do is they will automatically assign you the local chapter that is closest to your area. But you can go on the AAPC website, like I showed, and show the networking, and then you can select by state, or there's a button on the side that says list all chapters, and it'll list every single chapter in the United States. For those of you that are watching from another country, if you go to AAPC Global, they probably have a similar function as well. When am I starting personal tuitions? Do you mean tutoring for beginners from outside your country? Yeah, so right now I'm not doing one-on-one information. I've got quite a lot on my schedule as it is, with just the YouTube videos, with the on-demand courses, and other tasks that I have kind of right now. So right now I'm not taking on tutoring students, personal coaching students. It's something I might be doing in the future, but right now, not something I am currently offering. Liz, that is a great question. So is there a book for new E&M based on the medical decision-making coding scenarios? Yes, there is. So the AMA published the E&M Compendium, and you can find that on Amazon as well. I haven't had a chance yet to read through it as thoroughly as I wish I did, because I do want to make a video on that as well, like a kind of, is the E&M Compendium worth it? But from people who I know who have been in E&M a lot lately, that they really like that. So you can find that on Amazon. It is called the Evaluation and Management E&M Office Visit Compendium 2021. So you can find that right there. It is $43. You can buy it digital. So I have the digital version. Let's see actually if I can bring it up here. Da, 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 da. But yeah, you can download it on like your Kindle for cheaper, and it's very, from what I understand, I mean, it's the official guidance from the AMA, so they give you all kinds of case scenarios and stuff that makes it a lot easier to understand those 2021 guidelines based off of medical decision making. Diane, thank you for the super chat. I appreciate that, Diana. Thank you so much. That was really, really very, very sweet. Super sticker. Awesome. Really appreciate that. Thank you so much. Let's see. I know I saw something else in here. Where is it? Oh, Evelyn's asking, I need to create or update my resume in preparation for looking for jobs. Do you have any recommendations or references? Absolutely, I do. You should go over to projectresume.net. That organization is run by Annie, and she does a phenomenal job with doing resumes just for medical coders. It looks like it's maybe it's just my internet is going a little bit slow right now, but projectresume.net, I'll even post it in the chat here. And they specialize in doing resume reviews, revisions, new resumes, updates, all kinds of stuff just for medical coders. So definitely check them out. Annie Barnaby. She's great. Oh, it's not posting to Facebook. What the heck? Hold on. Am I still here? Is my internet still working? Yeah, maybe the website's just not loading right now. Hopefully it'll be back up in soon. All right. But yeah, projectresume.net, they're the ones that everyone says that their resumes have looked absolutely phenomenal. And she knows all of the terms that will help get your resume pulled up when they're searching for a specific candidate. So when recruiters are looking for a specific medical coder, they have a database of all these different resumes, and they'll search for maybe something that they're looking for, maybe surgical coding or epic experience. And she knows all those words to make sure that if you have that experience, that they're in your resume, so that your resume will pull up in that search directory when they're looking for a specific candidate. Z Marie Key says, I follow you here, Instagram and LinkedIn, and you are amazing with all the information you put out. Always looking forward to your videos. Thank you so much. I greatly, greatly appreciate that. Yeah, that's what I'm here for. I am here to make awesome content that helps people out. That's really what I'm here for. Occasionally sell you things, but not predominantly. I really just want to make awesome content. Some of that content that will be for sale. So, hey, well, there it goes. There goes Project Resume. It's probably my internet, I'm sure. So yeah, you can get resumes done from here, and Annie Barnaby will hook you up. Make sure that your coding resume looks awesome. Hey, Victoria, I saw your video about you suffering a little imposter syndrome, and I wanted to let you know that you and your videos motivate me and keep me going in medical coding journey. Thank you. I appreciate that. I really appreciate that you took the time out to come and leave such a wonderful, sweet comment. I really do, because it makes it worth it with all the time and stuff that I put into planning all of my videos. La is asking, when do you think AAPC is going to be offering more exams in more locations? Hard to say. We're kind of heading towards the final quarter of the year. So again, it really is up to those local chapters to schedule the exams for their area. And right now they're just kind of, working up against all the different stuff going on with how to find locations. Some of them have gotten really, really creative. They're renting out libraries or restaurants during their downtimes and getting that information out there that they're hosting those exams. So keep checking back on the AAPC website. But again, yeah, I know it's tough, but some of them, I will note that you don't have to take your exam at your specific local chapter. So if they've assigned you to a specific chapter, you don't have to take your exam at that chapter. You can take it elsewhere. But the way that you can find your exam, for those of you that are kind of searching, is if you go to the AAPC website under the certification tab, and then you go to locate schedule exam. That's how you can locate the exams in your area. So if you're looking for a specific state, so for example, I'm in Pennsylvania. You guys I love you guys today with all the super chats coming in. You're killing me today. You're killing me. I'm gonna cry. But yeah, so I still have, I shouldn't even maybe tell you this, I still have my voucher out for my billing certification to take the CPB. So these are how you can find all the ones in your area. I was going to sign up for this one on the 16th, but my boyfriend's friend is getting married. So I don't know what I'm going to do now myself, because I have to get this scheduled by the end of November, I think. And yeah, there's not a lot in my area. I might have to travel as well. Oh, there's the one that I'm hosting. Yeah. Does anyone want to go out to Schnecksville, Pennsylvania on September 25th? I'll proctor your exam for you. I can't give you special treatment, but I can proctor your exam for you there. Elizabeth, thank you for the $20 super sticker. I really, really greatly appreciate your support. That is so awesome to see all the support today. Yeah, we've been hitting crazy numbers with the live stream. Really exciting. I feel like I should have done something for my 30,000 subscribers, but maybe I'm going to wait and have a big one for my 50th. Marissa. Yeah, Marissa, I think I definitely think you could help me with the CPB. I think you have some definite insight on that one. Hey, Marissa. So let's see what we got. Do you think having the ICD-10 CM guidelines printed out separately is helpful, or too many books to have for the CPC exam? So here's my tip on that. If you haven't already gotten your books, or you're getting new ones for next year because you're going to be sitting for the CPC exam next year, I love the books where they have the chapter specific guidelines like right at the front of that chapter, so you don't have to flip back and forth. I think it depends. It depends on what you're working on. if you're someone who you like to spread out and you can have your guidelines here and work on that, and you can get them printed and bound or something, smash the like button, Paul, you guys are killing me. If you can work spread out and have the printed guideline, and that's not going to distract you, I think having the printed guidelines is good in lieu of having one of those books where you can have those chapter specific guidelines at the front. I think the AAPC, if I remember correctly, I don't remember exactly. I feel like I heard something somewhere that they are possibly for next year going to have the books changed for the AAPC editions and have the chapter specific guidelines at the front of the chapter. Because right now they don't, they just have note pages and stuff. But like the Optum 360 inversions and stuff, they have those chapter specific guidelines at the front. So if I were to open up to my chapter 13, at the front of chapter 13, all the chapter 13 guidelines would be in there for certain versions. But I think they're doing it for next year. If anyone has gotten their AAPC ICD-10-CM book, I think they're either out or shipping soon. Definitely let me know because I'm very curious. Lynn says, hi, love your channel. I'm in medical billing and coding program right now. Awesome. Yeah, let me know where you're going through. Are you going through an online program through the AAPC? Are you going through a community college? Going through an independent instructor? Because there's some awesome independent instructors out there. I know a lot of them. Speaking of meeting up with all of my friends and instructors, HealthCon's coming up in March, so a little while, but I will be there in HealthCon. I'm driving down to DC, and Marissa, I think, might be there as well. So I'm definitely, once it gets closer, we'll be looking forward to meeting and taking selfies and high fives and doing all that fun stuff at HealthCon next year. So we are actually I can't believe it's 3:00 already. This time is just flying by. I'm going to take one last question from Pam. I feel like, did you email me earlier? I haven't been getting into my emails as in depth lately as I probably should be. Can I take your CRC course and not have anything prior to that? I'm an LVN, so I don't think I need the terminology. Yeah. So if you already took MedTerm and you already know a little bit about health insurance, you can go right to my CRC course or someone else's CRC course or the AAPC CRC course, because that's just one of the, hey, thank you for becoming a member. That's one of the big things with the CRC is you have to know MedTerm, you have to know a little bit about insurance, like the difference between a Medicare product and a Medicaid product and a commercial insurance. So if you're just looking to get your CRC credential or starting with the CRC credential, then maybe going back and getting your CPC or CPB or whatever other certifications, you definitely can do that. So yeah, so my course, I just ask that you have MedTerm, and that is 100% on demand. And then I have office hours every week. I open up an hour and say, hey, all of my students, you can come in and ask questions if you have them. Most times people don't have questions. So everything's just really very well encompassed within the course. So thank you guys so much for another awesome live stream and for all of the super chats and super stickers that came thing. I am just, my mind is boggled right now with the amount of support that I've been getting. I wouldn't do it if there weren't so many people out here that were gaining knowledge and value and support and boosting their careers through this channel. And I'm so happy that I've been able to continue to do this. Thank you all, everyone, for your support. I will see you guys next week. And until then, just keep on coding on.